We have the Trauma Nurse Core Curriculum course going on this week. This course is training nurses to become trauma experts when it comes to taking care of trauma patients. In addition to that, we have 3 nurses that are being trained as instructors. We always need instructors here at Blanchfield, here at Fort Campbell, so that we can train our own nurses. In addition to that, we actually have an instructor from BAMC here training one of our nurses as an actual faculty, so that we no longer have to use resources from San Antonio to come here and train for us. We'll be able to provide all this training ourselves, so we're really excited about that.
My primary mission is to go to different military hospitals and help set up the trauma nurse program. We call it TNCC. My main job here at Fort Campbell is to sign off the lead instructor so that they will be able to make instructors, run courses, and will not have to use outside sources to train the GS and military nurses and LVNs.
Over the years, we have been trying to grow our TNCC program because you have to have quite a few instructors. And so today we have 3 instructor potentials, and so we're signing them off to be able to be a full instructor like myself. So we teach them a class the day before, and then we have them teach courses and we evaluate them today. And after today, they will be full-fledged TNCC instructors.
The course is very strict in the requirements that you have to make to become an instructor. So I took the course myself about 11 months ago, and you have to score a certain percentage on your written test up in the 90th percentile, and then as well as your hands-on portion, you have to meet all the criteria during that. And then you also have to have that presence when you're instructing. Are you a confident instructor, and do you have that ability to teach other people? Your evaluators at that time during the test will let you know whether or not they feel that you meet that qualification, and then once they decide that, then you go on to the instructor course, and you'll go through the course, and at that time they'll determine again whether or not they feel that you're best to teach other people.
Trauma care is a systematic process, and we teach them how to address the most life-threatening things first, and by addressing the life-threatening things that can harm a patient first, we can better help them. So instead of the distracting injury, we worry about what's going to harm them, like their airway, because if you don't have an airway, you don't have a patient. So we teach them how to decide what's the most important thing for each and every patient they encounter.
And then there should be another securing band, which I see you have.
Yeah.
I think you're missing your band
This
here.
training only serves to increase our competency here as a hospital, as an emergency department, as a community. I see it being a great asset to this hospital to create more polished and proficient nurses that can respond to any emergency here in the community, any emergency whilst deployed.
As a flight nurse with the Air Force Reserves, I think this training is also going to be incredibly beneficial, just because we never know what type of patients we are going to be receiving, whether that's stateside or in a deployed setting, and having this trauma preparation will better prepare me to take care of my patients.
So the importance of trauma and being able to care for trauma patients is that trauma happens anywhere. We have a really unique opportunity. We have active duty service members, and then we also have a lot of civilians. And so we have to be able to care for patients, trauma patients. They'll happen downrange, they happen here, and we all want to be able to take care of these patients the same way. So we teach them a systematic process to be able to care for them.
This is a program that is supported by military throughout the world. And the reason why it's important is that it helps our nurses be prepared to handle any trauma. And it's all about readiness. And so if the trauma happens in the battlefield, they're able to jump in and know how to prioritize. You can't get distracted by minor injuries. You have to focus on those things that are very life-saving. And so what the nurses are learning in this course is how to prioritize. Is the patient hemorrhaging? You got to address that first, because if they're bleeding out, it doesn't matter if they have a broken leg. If they're not breathing, if they don't have an airway, you've got to deal with that first. Again, it's all about prioritizing those life-saving methods, because what we do to stabilize those patients literally can mean the difference of life and death.